Last one's some miscellaneous myths. A small volume of aspirin increase other cells or platelets. Someone said, no, that's not true. The only thing you can concentrate by doing a proper aspirin is CFUs. That's crazy. No. You concentrate all of the different components of marrow when you do a proper aspirin. You get higher CD34 counts, hence all the protocols in hematology on how to do aspirins. You increase megakaryocytes, you increase CFU cells, you increase certain macrophages. So this is completely not true. How you aspirate impacts all the different cells in marrow, not just CFU. This one says, you cannot get rid of red cells in an end product if you don't concentrate. You cannot reduce the hematocrit without centrifuging and selecting out the buffy coat layer. That's not true. We know that if you centrifuge, eliminate all the red cells, and try and just take the little top, what happened in cardiology? Failed trial. You throw away all the stem cells. As it is, when you capture a buffy coat and you have a native level of hematocrit, you're still throwing away 40 to 60% of the stem cells in the red cell layer. You can't get rid of red cells with simple centrifugation without throwing away all your stem cells, or virtually all of them. There's too big an overlap. When you look at centrifuged marrow and you see that little white line, you should think of that. That's the very tip of the iceberg. That iceberg goes down pretty far. This one here, bone marrow aspirates get rid of clots, red cells, debris. We already covered that. If you don't have spicules, you don't have an aspirate. And spicules, we say if we put the slide on top, in the hematology instructions, they say, if I plate my marrow on the glass slide, I put the other slide on top to form the smear. The instructions, never push down hard on the upper glass, because just the weight of the glass will flatten out the spicules. Is that bone? Could you flatten bone out with the weight of a few ounces? And then the spicules are so small, they come through the filter anyway. So mostly what you're filtering out is fat. And then we're going to see in a minute, the fat's probably helpful. This one is at cord blood. Some people say, I'm going to use cord blood. Well, if you go back to hematology, oncology, I irradiate a patient, I'm going to transplant cord blood. I have to have an HLA match of 5 or greater, and I have to do some really serious immune conditioning, or the recipient is just going to reject the transplant and create an inflammatory response. So this idea of using cord blood without the background of immune conditioning, I think you're going to have growth factors released from the cells. You're going to have an inflammatory response against the cells, and that might be helpful. But I don't think it would be as helpful as using your own marrow, using your own fat, using your own tissue to try and repair and regenerate that area. So I'm not as big a fan on cord blood because I just don't think it biologically makes a lot of sense. And then placental tissue, it doesn't have living cells, but it does have growth factors. The way you process placental tissue, though, is different. There's so many of these cottage industries out there, and some of them process it in a way that you get a really nasty inflammatory response based on what and how you've processed that tissue. So I don't think there's a lot of standards around this. The cord blood, because it is an immune profile, I'm just not a fan of. It doesn't make sense to me biologically. And the matrix tissue, it's a little bit of the Wild West because there's so many different ways that it's processed. We covered this already, CFU interpretation found in marrow, not in blood. I count it because it's, that's my standard, and, it tells me I have a lot of all the other kinds of cells found in marrow. I'm not sure it's a meaningful marker outside of marrow, though. Like, I have so many CFUs and fat, I don't know if that tells me a lot. That's not to disparage fat as a very good biologic. I'm just not sure CFU is the right marker for it. And then why adipose tissue? So I'm a big fan of using adipose tissue. We have a product, we sell an adipose concentrate product, especially inside a joint space, the synovial fluid. It degrades fibrinogen, a platelet fibrin clot, aggressively. So even if I put marrow, whatever I put in there, if I can't get a scaffold or a clot to form, it's very difficult to get the kind of tissue repair I'm looking for. Whereas adipose is made of collagen, so it doesn't degrade in the presence of synovial fluid. It has cells in it, and a lot of times adipose alone is fine. And then the other thing is so much of the nutrients that come into feed the chondrocytes come from that synovial fluid. And when you have an inflamed joint, if you were to do a histology of that synovial fluid, it's highly inflammatory, kind of nasty stuff. So before you put your biologic in, we always suggest you do a lavage, a saline lavage, and that seems to work well. If I were to sum all this up, I'll go quick here, these last few slides. Why marrow? It's your body's natural response. When I transplant marrow, I exactly mimic and supplement the body's response. And there's another thing about marrow is when I transplant marrow, if I do a blood test 2 weeks, 3 months, 6 months post-transplant, I have a big elevation in the number of circulating stem cells. So transplanting marrow creates this ongoing feedback loop that creates a lot of extra stem cells in circulation. And when I think of that, that also partly explains this work where I have 2 knees, both have osteoarthritis. I treat one with marrow, the other one with saline. The end result was both knees did really well. Well, why would that be? Part of the explanation is when I treated the one knee with marrow, I now created a circulatory loop. Now I have so much extra cells in circulation. I had a clinical benefit in other parts of my body. And if you want to know the actual health of a person, a better risk factor score than the Framingham risk factor score for heart disease is to do a blood test and count AC133 cells. The number of circulating cells in your body, stem cells, will tell you your overall health and the likelihood you'll have a heart attack. Better predictor than the Framingham risk factor score. So that's why marrow, and we talked about why fat. This is just a schematic from a paper that talks about, your marrow, it thrives in a hypoxic environment, it homes to that hypoxic environment, it restores the tissue integrity, and then goes back to normal oxygen tension. So this concept of homing to hypoxia, that's the job of marrow. It goes to those areas and initiates the repair process. So when we think about treating a subchondral lesion or we have inside the joint degradation, it starts to make sense that on the joint side, I can use fat and marrow because I'm adding a scaffold with the biologic. And then on the bone side, I can use living bone dowels and aspirate. And so when I combine the two, I'm treating both sides from outside in and inside out to help repair that damaged knee. And that works, that same concept will work for hip and other joints. And then here's an example of some work when you actually use the right biologic, living bone, and marrow aspirate drawn from that endosteel surface. So you can see here, it's a revision surgery. You have a major defect. It was a cancer resection. It's a radiated bone. The first procedure failed. First procedure, they used concentrated centrifuged marrow. So now it's the second procedure, and you can see healthy living bone, strong enough to put in an implant. That is a major defect, and it was done using aspirate and dowels. Another one, now we're looking at subchondral knee. You can see, the lesion down below. Post-treatment, the lesion is resolved. Again, the power of using your own marrow to heal your own body. Exactly mimicking and supplementing how your body works.
Andy, just a few other questions here.
Sure.
Any benefit to mixing PRP with marrow?
Well, I think especially if you're treating a knee, you can use the PPP as your lavage, and then you can add the PRP with your other biologic to treat the joint. And while we talked about fat not degrading in the presence of synovial fluid, what's in synovial fluid that degrades the fibrinogen is a substance called plasmin. Platelets release a plasmin inhibitor. So if I have more platelets there, the integrity of the clot, the fibrinogen will last longer. So I think platelet-rich plasma is helpful in that context. And then we just need Dr. Tortland. Is he ready? He's up for the last slide.
Well, I want to thank Andy for coming in. That was really, really helpful. He did a great job clarifying a lot of the questions and issues. For everybody who's attending, and for those who will be watching this on video, little shameless self-promotion as a reward for you being here. You get 10% off of all the MSK ultrasound training videos. For those of you who are familiar with them, you know that they're outstanding videos, both for diagnostic MSK ultrasound and for interventional. All of the interventional videos show real injections on real patients with real pathology. If you go to the website and type in the code webinar, you'll get 10% off on all the videos. This is good through the end of the month. So take advantage of that. It's a great resource to improve your MSK skills. Thank you all for participating, and we hope to do this again in the future, maybe covering some other topics. And again, Andy, thank you for coming down from the Boston area and giving us some of your time this morning.
I want to say Dr. Paul did a video on marrow solutions and how to use it. It was outstanding. So the quality of those videos, I can attest to. They're great.
There is a video on how to do bone marrow aspiration. There's also a video on how to do lipoaspiration, as well as your routine MSK injections and diagnostics. So, of course, you can always email me with any questions. So, Nikki, thank you for moderating the webinar. I appreciate it. And to our film crew for the great job you guys did. Thanks, everybody, and have a great day.